Are you someone who is suffering from acidity for a fairly long time? Indigestion after eating fatty food, getting a lot of gases, and you tend to take a lot of acidity medications, be it allopathic or herbal medicines. You'll be surprised to know that this may not be a simple acidity problem. It could be something known as gallstones, and they really need to be looked into. So why do these stones occur or form in the gallbladder? As you might be aware, gallbladder is a organ which is present on the right side of the abdomen below the liver, and it is basically a storage organ for the bile which is produced in the liver. The bile is produced continuously in the liver, it is coming to the gallbladder, it is getting stored, and when we eat our food, the gallbladder contracts and pushes the bile into the intestine via the bile duct, wherein it helps in fat digestion. Now, if due to some reason the gallbladder is not functioning properly, it may be due to excessive fat in the body, maybe due to some infections of the gallbladder, well, then the gallbladder does not empty completely. There is a fair bit amount of bile getting accumulated in the gallbladder. The bile is rich in cholesterol. This cholesterol starts getting deposited and they form crystals which eventually turn into stones. So the point that needs to be understood is that gallstones form because the gallbladder is not functioning properly. Now, there is one important differentiation that needs to be made, and that is the gallstones are different from kidney stones, because many a times it happens that the patients, they want some sort of treatment which will help to dissolve the stones. Now, kidney stones are formed because there is some problem with the electrolytes in the urine. You can call them as electrolyte disturbances. The kidney is functioning normally there. However, in the gallbladder stones, the gallbladder is not functioning properly. It is diseased, and that is why the treatment for kidney stones and gallstones is different. Now, how does one really doubt that there are gallstones which are responsible for acidity? Well, you'll be surprised to know that many a times these gallstones do not cause any symptoms. They are known as silent gallstones. Sometimes you just get a routine checkup done and there is a gallstone. However, if this gallstone is 5 millimeter or less than 5 millimeter in size, and it is not causing any trouble, you can leave it alone. There is absolutely no need to treat this particular gallstone. Now, there are patients who have symptoms because of gallstones. The commonest symptom is a lot of acidity, indigestion or intolerance to fatty foods, what we refer to as biliary dyspepsia. Then there are patients who would get a severe pain on the right side of the abdomen. This usually occurs following a meal. It can last for a couple of hours. There is associated nausea and vomiting, and sometimes the pain is so severe that one has to go to a nearest doctor to get treated. Very surprisingly, this pain settles down, and again it is referred to as gas or acidity. However, if ultrasonography of the abdomen is done, the gallstones are diagnosed fairly easily. Now, apart from this, there are a lot of complications that can happen. There are things which can go wrong. There is something known as acute cholecystitis, wherein the gallbladder can get swollen. If a gallstone passes down the bile duct, it can get lodged there, obstructed, resulting in jaundice, what we call as obstructive jaundice, and also a serious complication known as acute pancreatitis, wherein the gallstone passes near the pancreatic duct. So it is very important to understand that the gallstones can cause really serious complications, and therefore it is important that we diagnose and treat them appropriately.